May adlaw na tong tanan. Do you have difficulty moving your arm because of your stroke or paralysis? If you answer yes, then I'd like to show you techniques and strategies on how to unlock the movements of your stroke arm. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. When you have a stroke, the most difficult part to regain movement and function would be, yes, your arm. That is because the arm requires more fine movements and control. Most studies and approach recommend a top to bottom approach, meaning you start reactivating and retraining from the top, which is your shoulder, going down to your hands and fingers. So in this video, I'm going to teach you techniques and strategies on how to unlock your shoulder, which is the topmost portion of your arm, in order to regain movement and function. And keeping the integrity and strength of your shoulder is very necessary in order to prevent subluxation, or that detaching of the arm away from the shoulder. And it is also the biggest culprit of shoulder pain after a stroke. And so if you are ready, let's get started. On the first stage of stroke, the arm that was affected is going to be flaccid, usually flaccid, meaning when you pick it up, it just drops. And it doesn't have any motor movement, and it's just flailing around. And the first goal is to wake up that arm. And you don't need any fancy equipment. All you need is a hairbrush. All right? So again, we are going to awaken the arm, the stroke arm, starting from the top to bottom. And in this video, we are going to wake up the shoulder. So what you want to do is to get you a hairbrush, and you start just tapping. Tap at your traps, this area, the top portion. Tap it for a few seconds. It would help if you can tap it for 30 seconds. And then you go to the back towards your shoulder blade. Just tap very lightly. You don't have to be whacking your shoulder. Just gentle but fast tapping. All right? So this technique is called fast tapping. After the shoulder blade, you go to your deltoids. So you're going to just tap, starting from the back, the side, and the front. And do not forget your chest. That is still part of your shoulder. All right? Aside from tapping, you can also do fast brushing. So that's why I like a hairbrush. So you're just going to brush quickly in order to awaken that stroke shoulder. Again, this is for people with stroke immediately after they have the stroke. So the arm is still flaccid. Now, if you already have a muscle tone, you don't have to do this part. Okay? So fast brushing and fast tapping using a hairbrush in order to awaken an arm that is flaccid. Stretching the shoulder that is affected by a stroke is also very necessary in order to regain movement and function, because if you have limited range of motion, then you won't be able to move that arm very efficiently. So the first technique is going to be a massage. So what I like to use is my knuckles, just the hand of your non-affected side. So make a fist, and first I like to massage the chest. Usually the chest is very tight after a stroke. So I massage this part right here. After that part, I also massage the traps. Now, if you have somebody who can help you massage these areas, that will be much better. There are people who have nobody at home to help them out. So I am showing these techniques by myself, not having a patient with me. So if you have somebody, so much better. After the traps, I also massage the deltoids, the front, the side, and the back if I can reach it. Now, if I cannot reach it, or if you cannot reach it, just use the fingertips. So just squeeze and swipe. All right? That's how you massage your shoulder. If you can reach your shoulder blade, so much better. So massage that area too. So you are able to effectively stretch your shoulder. So now we're going to do the stretching proper. So the first stretch is going to be just a shoulder flexion or reaching up. Be sure to be gentle when you do this, especially when your arm is already beginning to be spastic or tight. So you're going to stretch up and down. Do not forget stretching to the back. All right? You can also use your chair to stretch your arm back. Again, be gentle. If you are unable to reach back, that means that your your chest is still tight. So massage that area, gently bring that arm to the back, and then lean forward to stretch it backwards. Next will be to stretch your arm out, like so. Okay? Now, if that is difficult on your own, sit on a chair with armrest. Gently pry your arm open. Bring it to the outside part of your chair and then lean away in order to stretch that shoulder. Another technique that I use is I lean forward. I make my patients lean forward in order to open up that arm. See? Even if my arm is like this or your arm is like that, you lean forward, you let gravity assist in opening up that shoulder. All right? It opens up that part right there. So it stretches as well. All right? So that is how you stretch your shoulder after you have a stroke. Another way in order to awaken the shoulder after a stroke is using associated movements. Associated movements are movements that come out when you are trying to do a difficult task. So in this video, my stroke arm will be my left arm, which is the arm with an X on the hand. So we're going to use that associated movement. And the first movement we're trying to do is going to be a shoulder shrug. In order to get that associated movement, try to put a bag on that good side and try to shrug your shoulder like this. So initially, your affected side, the shoulder of your affected side will have very little movement or no movement at all. So practice with the good side first, doing a shoulder shrug. And if you have somebody who can put their hands over your shoulder and push down, that will be better. Do not put a lot of pressure on that side because, again, that side doesn't have any movement or strength yet. So that hand will just be on top in order to give it a cue or a point of reference on what movement you're trying to do. All right? So on your own, just use a bag and try to shrug your shoulder. So do that a few times. Let's try to do 5. 1, 2, 3, 4, and 5. Now the next movement, you can put this away now. The next movement will be to push forward. So in order to push forward, we're going to put our arm behind our chair and try to reach forward. Now the associated movement of your affected side will be try to reach forward. It's trying to help your good side to do the movement. Since this is having difficulty, your reflex, the body's reflex is to try to help that side. So try to push forward and focus all your attention on that affected side. Try to reach forward too. So like that. Now for pulling back, because we also need this movement for your shoulder to pull back. Just sit up and try to push your chair backwards like so. And so bring your affected side there so that the back of your arm feels the chair behind you and try to push back. So there's not a whole lot of movement there. It's more of a isometric contraction, and then focus all your attention there too on your affected side. Now for the abduction or opening of your shoulder, lean towards the armrest and try to open up your arm. So open up your arm like this. And try your best to open up the arm of your affected side, like so. Let's try to do 3. 1, 2, and 3. And that is how you use associated movements in order to awaken that shoulder, that stroke shoulder. If your stroke arm is beginning to have muscle control and movement, you need to start doing active assistive exercise, meaning your good side will assist your affected side during the movements, okay? The first exercise is going to be just shoulder flexion. So, hand under the elbow and then try to reach up. Go slow with these exercises because again, the shoulder is still weak, and so there might be subluxation there. We don't want to compromise the integrity of that shoulder. So again, going up. Let's do one more, like so. Now you also need to do a shoulder extension. So you're just going to push away, push away. So again, if you have somebody to help you, so much better. But make sure that you are doing most of the movements. Focus, concentrate on those movements. And if you're a caregiver, give a cue. Always give instructions. Reaching back, tell the patient to reach back, or elbow back, okay? Elbow back. Point your elbow backwards. Point your elbow backwards. One more time. Reach back. Next movement, you're going to do abduction or opening the arm. So abduction like that. Open. Concentrate. One more time. Open. You don't have to make 10 repetitions because, again, that shoulder is very weak. So just do a little bit of movement like that. All right? Again, active assistive exercise. Next one will be internal and external rotation. All right? So opening. Keep that elbow tucked to your belly or to your side. In and out. In and out. Focus on your shoulder blade during this movement. In and out. And that is your active assistive exercise. Now I'm going to do the attendance check in order for me to know who is serious in getting better and recovering from their stroke. So the word is unlock. Type down below the word unlock. All right? So let's move on to the next exercise. Since we want to unlock the movement of our stroke arm, we shouldn't be always assisting that arm in all movements, in all exercises. So we need to do active exercises as well. So the most common one that we use in the clinics or with your home health is table wiping. So put your arm on a table and then wipe the table in and out, and forward and back. Wiping the table eliminates some of the effect of gravity in pulling your arm downward. So your arm is less heavy. It feels less heavy. Always focus, always concentrate. Next movement that you need to do is elbow pointing forward. Now, if you are strong enough, straighten out your arm and raise your arm up. Raise your arm up. But if your elbow is still tight or your shoulder is still weak, just concentrate on pointing your elbow up. All right, let's do 3. 1, 2, and 3. Again, you don't have to do 10 because your affected side is still weak. We are trying to regain the function and strength. Next one, we are going to point our elbows back, like so. Let's do 3 again. 1, 2, 3. Next, you're going to open up your underarm, like so. All right? So 1, 2, and 3. Next movement, internal and external rotation. So rest your elbow on your belly or to your side. Bring your forearm close to your belly and then bring it up. Bring it back down. Bring it up. All right? Bring it down. Bring it up. All right? So if that is too difficult, try to lean sideways on your chair, like so, and you're letting gravity help you in bringing that forearm away from your belly. So help it up like this, and then do your best to bring that forearm away from your belly. Bring it back in, like so. All right? And that is your active exercise to unlock the movement of your shoulder after a stroke. There you go. Those are the techniques and strategies in order to unlock movement of your arm after a stroke or paralysis. So just remember to do a top-down approach so that you have a system, but it doesn't necessarily mean that movement comes from the top to bottom always. Our body is a mystery. Our body has a wonderful sense of trying to recover after an injury, so do not give up. And if you have any family and friends who will benefit from this video, please share it to them, especially to those who have no access to therapy. Share this video to your social media accounts. Help them out. Who knows? You will be the one who can help them out if you share this on your social media. And if you have any questions, suggestions, or comments, just type it down below in the comment section. And just a reminder, consistency is the key and never give up. Until next time, paalam! Shoom!